Hello, this is Matt Starr with Starr Wellness Coaching. If you're watching this video, you're a doctor who's received my letter or your office has received my letter. So you know just a little bit about me and you're watching this video, so that shows that you have some kind of interest, which I appreciate. Um, I'm a wellness coach. I work one-on-one with people that have hepatitis C and liver disease. I know a lot about that because I have hepatitis C and I had a liver transplant myself. Um, Things got pretty rough in my recovery, and so there was a point at which it felt like the spiral down into darkness was never ending. And I really began to question, the meaning of my life and what was going to happen to me for the rest of my years. Feeling a loss of control, deep core fear, the type of things that are associated with this kind of illness for a lot of people. So I have a great gastroenterologist at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. Thank you, Dr. Tour, if you're watching. And that has been a great blessing for me. I found, though, that I needed more time than was allowed by my doctor's visits because of the amount of people that walk through the doors of the hospitals and the caseload that doctors have. There just isn't the time that I needed to really dig in on some of my attempts to become more well again. I take medications from the hospital, and I also now have found myself going to a community clinic for over a year, where I have slowly but surely adopted the practice of acupuncture, which has been helpful. I take herbs for liver support, and I've also really looked closely at my diet. I already ate well. I live on a farm, but now it's a plant-based diet, very little red meat. And that seems to be helpful. All foods that are good for my liver go into my body. Pretty much only foods that are really good for my liver. And my yoga meditation practice is deepened. It was always there, but it's much more consistent and long. And I look at that as a meditative time that I step into healing, bringing in whatever I can bring in from all around me and from within of myself to become more strong and more well. I've had great success, and I'm doing now things that I thought I'd never do, or I wondered if I'd ever do again. I'm swimming again, a mile, mile and a half most days. Go for little runs, little bike rides, not like it used to be. I was an endurance athlete, and that was an important thing to me. So to be able to return to some of these activities, even if they're compromised compared to where they were, is a great feeling. And really, that's a part of the work that I do with people, is recognizing just the beauty and to have gratitude and appreciation for where they are, wherever they are. And that may not be doing the kind of more vigorous now activities that I do, but just might be sitting in the grass, feeling and seeing and smelling the beauty of the world that we live in. From that place of appreciation and gratitude and thankfulness, we can begin to aspire to find more and to love the life that we live, regardless of the circumstances. So I hope that your work with patients, which is so important and so appreciated by many, um, can be augmented by someone like me who can spend a lot of time with people one-on-one, and support them and build relationship with them and operate in a place of caring about their recovery, and have a commitment to that that's based on as much time as needed and setting a plan together. So they tell their story, I tell them mine. We see if there's any connection there, any fibers that might resonate for them, and not to intimidate them with where I am now, but rather to say, that there's hope. And um, so then we come up together with, given their sort of belief systems and where they are at this time themselves, come up with a plan for healing that I hold them to, that they are accountable to, and I hold that space for them and push as needed in a firm but yet loving way. And we work over a period of time to achieve some of the things that I know all can achieve, which is to feel better. So that's my work. My hope is that I can network with you in your offices where you see a lot of patients with hepatitis C and liver disease, and that you feel comfortable putting my business card in their hands and saying, here's someone who might be able to help you. Why don't you call him and just see what he has to say. Then it's up to them, and their conversation with me can lead them to jumping in with me and getting work done together or not. So you're off the hook at that point, but you have at least given them an opportunity for something a little different, something that involves more time and more personal accountability for their own wellness. So that's my story, and that's my hope and dream, that I can help you help people with hepatitis C and liver disease. Thank you very much for the work you do. Thanks for watching the video. And it's Matt Starr at starwellnesscoaching.com, 2 R's in Star. And you can catch my contact information there and reach out to me and let me know if there's anything else you'd like to know, or if you're interested at all in me mailing you cards. Okay, thanks a lot. Bye.